Jackie, I thought child labor is illegal. Why do kids need occupational therapy?
Right, we get this question. Parents think, occupation? My children don't have jobs. Why would they need occupational therapy?
What gives?
An occupation for a child is anything that occupies their time.
Okay.
So in childhood, that is school, that is play, that is learning to take care of themselves, like getting dressed and all the things that fill their day.
Okay. Getting dressed. What other things what are the reasons why families would say, I think my kid needs to go to OT?
Yeah, some really common reasons are not meeting their developmental milestones, particularly in fine motor skills. The ability to button, zip, write well,
Okay.
but those usually come a little bit later anyway. Babies who are not grasping and self-feeding might need an OT to evaluate.
The parent would see, they reach for something but it slips out of their hands.
Or they're not reaching for something. They're not coordinating that movement. They see something and they're not able to get their hand there.
Got it.
Other children come, a lot of kids get referred to OT for behavior, concerning behavior. Those kids that are nonstop movers, the kids who overreact maybe emotionally to situations where their peers seem to handle it better. The children who have a difficult time paying attention and focusing on a task or following directions. That's a lot of OT referrals in childhood.
Okay. I do feel like you just described every kid I've ever met, though.
Right.
Okay, so help me narrow it back down. Maybe, I definitely can see the hand-eye piece. When does a parent know that there's a problem opposed to, my kids, this is normal development stuff?
Yeah, so that conversation usually starts with the pediatrician. When parents take their child to their wellness visits, every couple of months at first in infancy and then every year in young childhood, the conversation starts with the pediatrician, and they might say, this type of skill or that type of skill looks a little bit behind, let's refer you to OT. Often it's also the parent's gut instinct. If the parent just has this nagging sensation that my child doesn't seem to be like their peers, because there is a wide range of what's considered typical in behavior and skills, and some children fall outside that and the parent seems to just know. And we say bring them in for an evaluation, because the OT will give you that peace of mind by saying, yes, there are some things that I see that we should work on, or no, your child is falling within the normal range and they don't need OT at this time.
Got it. So the first layer is instinct of the parent. Next layer is we're going to go to our pediatrician. Pediatrician may refer them to an OT. And if you see the child and you say, no, this is about normal, you'll actually just say, hey, this is okay.
Right. We do not want to keep anybody coming to therapy sessions if they don't need it. We've got plenty of other children in the area that do need it.